see you there. My name's Alyssa, and today we'll be talking about traumatic brain injuries, otherwise known as TBIs. In this video, we'll discuss the dangers of TBIs, signs and symptoms, causes, treatments, how to diagnose, and how to prevent TBIs. I'm sure you're all very excited to dive into this topic, so let's not waste any more time. A TBI is physical injury to the brain due to external force that can cause temporary or permanent brain impairment. A hard blow to the head causes the brain to strike the inside of the skull at the point of impact. The brain squeezes against the inside of the skull, causing neurons to tear. This is called diffuse axonal injury or axonal shearing. The tearing of axons results in loss of communication between neurons, causing impaired neuronal activity. During a coup-contra-coup injury, the brain collides with the skull at the site of impact, but the force also causes the brain to strike the opposite side of the skull, injuring both sides of the brain. This damage to the brain causes edema and hematoma around the sites of injury. The skull does not provide extra room, so any swelling will increase the intracranial pressure, or ICP, in the skull. Cerebral perfusion pressure, or CPP, is the force that dictates perfusion of cerebral tissue. CPP relies on the difference between mean arterial pressure, or MAP, and ICP. If ICP increases to approach MAP, then CPP decreases. This decrease in CPP will result in hypoxia of brain tissue. If ICP matches MAP, then CPP ceases, and ischemic injury will occur to brain tissue, resulting in brain death. Increased ICP first causes brain dysfunction, and if left unrelieved, brain tissue will begin to push out of the foramen magnum. A mild TBI is also known as a concussion. Some signs and symptoms may include confusion lasting 1 to 2 minutes, possible amnesia,
God, what happened?
headaches,
Oh man, dude, my head hurts.
dizziness,
Whoa,
blurred vision,
man, dude, can't really see that well.
ringing in ears,
Do you hear that? Somebody's phone going off? What's going on there?
fatigue,
Time to watch some TV.
behavior or mood changes,
The stupid remote isn't working.
During moderate to severe TBIs, symptoms may become more worrisome. They include persistent or worsening headache, nausea,
I don't feel so good.
vomiting,
Hey, yeah, me at the park, you know, and
Slurred
do whatever.
speech.
We can, get to hang out in the gazebo and stuff.
seizures, pupils that are slow to react or are fixed, oval-shaped pupils, loss of coordination, increased agitation or confusion, loss of consciousness lasting a few minutes to a few hours.
There are many ways to diagnose a traumatic brain injury, but many facilities utilize the Glasgow Coma Scale. The Glasgow Coma Scale utilizes a point system to determine neurologic function.
Spontaneous blinking. Eye opening in response to verbal stimulus.
Sir, can you open your eyes, please?
Bam!
Eye opening in response to pressure stimulus.
Hello?
No response.
Sir, can you open your eyes? Sir?
Individual is oriented to person, place, and time.
Sir, can you say your name, where you are, and what time it is?
And what time it is? My name is Antonio. I am at my house, and it's 6:30 p.m.
Individual is confused but is able to respond to questions.
Sir, what's your name?
My name's Tony. What? Why are you here? What's going on?
Individual provides inappropriate responses or single words.
Sir, do you remember what happened?
Pizza. Definitely pizza.
Incomprehensible speech, moans, or groans.
Sir, do you remember what happened?
No response.
Sir, can you hear me? What's your name?
Obeys commands for movement.
Sir, can you wiggle your fingers for me? Great.
Purposeful movement in response to painful stimulus. Withdraws with painful stimulus. Flexes with painful stimulus. Extends with painful stimulus. No response.
On the Glasgow Coma Scale, a score of 13 to 15 indicates no injury or mild injury. A score of 9 to 12 indicates moderate injury, and a score of 8 or less indicates severe injury. But remember, when using the Glasgow Coma Scale, alcohol, drugs, or illnesses such as diabetes can produce an inaccurate Glasgow Coma Scale. When diagnosing a traumatic brain injury, using the Glasgow Coma Scale is a good first step. But an individual may need a CT scan or an MRI to properly diagnose and further understand the extent of the injury.
A CT scan can show contusions, acute bleeding, and hematomas. An MRI can show diffuse axonal injury, brainstem injury, and more subtle contusions.
When treating a TBI, always care for ABCs initially. Providing oxygen can also help avoid ischemic injuries. The severity of the TBI determines the treatment.
For a mild TBI in which the individual did not experience unconsciousness, has normal CT scans, has vitals that are within normal limits, and displays normal neurologic function, they are allowed to go home. However, this individual needs to return to the hospital if they experience decreased level of consciousness, worsening headache, vomiting, seizures. For individuals with moderate TBIs, intubation or ventilation is usually not required, although observation in the hospital overnight may be required due to a risk of deterioration. For severe TBIs, patients need to remain in an ICU, or intensive care unit. These individuals usually need to be intubated and ventilated due to impaired airway reflexes. These patients need to have their arterial blood gases monitored as well as oxygen saturation. The head can be elevated to assist in cerebral venous drainage. Osmotic diuretics can lower ICP by increasing renal excretion of water. Sedation can help to prevent excessive muscle activity that would otherwise increase ICP. Cerebrospinal fluid can also be drained to help lower ICP. Some patients may require a decompressive craniectomy, during which a portion of the skull is removed to relieve ICP.
With modern technology, most TBI patients retain normal neurologic function. However, complications can occur. During post-concussive syndrome, symptoms can last weeks or even months after the TBI. These include headaches, anxiety, irritability, insomnia, inability to concentrate, depression, fatigue, and short-term memory loss. After a TBI, patients might also experience post-traumatic epilepsy, or PTE. Those with open brain injuries are at a higher risk for PTE than those with closed brain injuries. PTE can become a lifelong complication. While there is no current proven cause for PTE, some theories include a decrease in GABA inhibition or hyperexcitable neuron growth after injury. If there's any football lovers out there, I'm sure you've heard of the next chronic condition, called CTE, or chronic traumatic encephalopathy.
CTE is a neurodegenerative condition due to an increase in the abnormal protein tau, caused by repeated TBIs. The TBIs do not need to be significant injuries to increase the risk for CTE. Mild concussions can cause CTE. Early changes in the brain during CTE include enlargement of the brain ventricles where CSF is produced. During intermediate and advanced CTE, atrophy of gray and white matter occurs, brain weight decreases, and the corpus callosum decreases in size. The most common causes for TBIs include falls, motor vehicle incidents, collisions with objects, assaults.
We've talked a lot about TBIs today, but you may be asking yourself, how do you prevent one in yourself and in others?
You should always wear a seatbelt in vehicles. Make sure children are placed in the correct car seat or booster seat. Never drive under the influence of drugs or alcohol. Always wear a helmet when necessary. Help older adults prevent falls. Make living areas safe for children.
Today, we talked about signs and symptoms of TBIs, the dangers of TBIs, how to diagnose, treatment, and prevention. I hope you all learned something today about TBIs that'll help keep you and your loved ones safe.